The surprising thing about the way in which the government reacted to the pandemic back in March 2020 was that it used the Public Health Act to introduce restrictions. And it was always possible for the government to use an act of parliament called the Civil Contingencies Act, which gives the government extraordinary powers in emergencies. We may disagree, and I would, that it was appropriate to use that in the reaction to the pandemic, and whether it was appropriate to impose anything like the restrictions on public life that were made. But the difference is that if the Civil Contingencies Act had been used, the government could legislate in an emergency, but it would have to call both houses of parliament back within 7 days. And that applies whether or not parliament is prorogued, it's not sitting. And even if it's been dissolved, there's a special mechanism, dissolved for a general election, there's a special mechanism of calling it back. With the Public Health Act, on the other hand, there was no such duty. And so when the regulations were made, that parliament would have to consider the regulations and would have to debate them, but only within 28 days, and that did not include periods within which Parliament wasn't sitting. And as we will remember, Parliament didn't sit for lengthy periods in 2020, in March and April 2020 in particular. There is also a serious question as to whether it is appropriate and lawful to use the Public Health Act. The Court of Appeal has said that it is, and that it can be used for these widespread purposes. And that suggests that that act needs to be amended to make clear that if wide-ranging regulations are going to be made that affect all parts of public life, that can only be done under the Civil Contingencies Act. In other words, to strip the possibility of the Public Health Act being used again to introduce lockdown. Now, of course, Parliament is sovereign, and if Parliament wants to pass an act of Parliament, there would be nothing we could do about it. And also, if ministers wanted to use the Civil Contingencies Act, that would be lawful because they are able to use that to change the law, change primary legislation, at least for short periods. But that is subject to very serious and stringent safeguards, which require parliamentary debate. And that is what we needed back in 2020 and 2021, and what we didn't have. In relation to the Public Health Act, that is obviously something that is suitable to write to your MP about, and to explain that the Public Health Act as a vehicle for introducing regulations in response to pandemic is wholly unsuitable because it does not allow Parliament to scrutinise legislation that can have extreme consequences within a very short period, whereas the Civil Contingencies Act does. And I would encourage you to write to your MP about that and explain that this isn't just a matter of whether you agree with lockdowns or not. It's about parliamentary scrutiny and the need for that scrutiny whenever ministers act. And as you may know, one minister can make that legislation and it becomes law unless and until Parliament votes on it within that 28-day period. So that's an extremely important thing to do.